Hello and welcome to Everyday Oral Surgery. This is your host, Dr. Grant Stucki. I am an oral and maxillofacial surgeon practicing in Denver, Colorado. The goal of this podcast is to connect, learn, and inspire. In this podcast, you'll be hearing from OMS surgeons all over the globe discussing ways to improve the practice of oral and maxillofacial surgery. Most information shared in this podcast will be based on personal experience and opinions, so please supplement what you learn here with approved research studies. Without further ado, please enjoy today's episode. Welcome back to another episode. Today I'm with Dr. Anish Gupta. He is an oral and maxillofacial surgeon practicing in Michigan. Anish, thanks for joining us on the podcast today.
Yeah, thanks so much for having me.
Yeah, this is awesome. I wanted to see if we could start by just having you give us a brief history of your training and your current practice setup.
Yeah, absolutely. So right now I'm in private practice in New Hudson, Michigan. It's a small city somewhere halfway between Detroit and Ann Arbor. And my training, I born and raised in Michigan. I've stuck around here for most of my life. Undergrad at Michigan. I did dental school at Detroit Mercy. Graduated in 2010. I did quite a few things in between. So I taught at the dental school for 2 semesters. I was a general practitioner for 1 year. I did the 1 year anesthesia fellowship at Indiana University for a year before I got into oral surgery, which was at Medical College of Wisconsin. And I finished up there in 2017. So I've been in private practice in Michigan since then.
Well, that's fantastic. So a lot of good experience and different realms training.
Quite eclectic, I think. I don't know. It's kind of the same reason why I like AI, even though I'm a clinician. It's that just like this side of me that's always like interested in other things too.
This is awesome.
Yeah.
And that was kind of one of the first things we wanted to talk about is just the applications of AI in oral surgery. Where would you start us off on that topic, like of how surgeons could potentially use AI to help them in their practices?
Yeah, probably should give a disclaimer first. Like I don't have formal training in it or anything like that. I think you actually had maybe it was your brother's co-resident on.
Yeah.
Maybe it was like a year ago or 2 years ago who talked to someone on this topic. I listened to that episode, and it's incredible how much has even changed in 2 years. I mean, AI has been a buzzword for a while, but I think it's just interesting what we can and even can't do for it. And the other disclaimer I'd like to give is that, you know, I'm probably, I don't know the right answer. Some people are like, never do AI because it's going to take over the world and Skynet. And some people are just like all in and and I think that the answer is the happy medium somewhere in between where AI plus me is a better version of me or AI plus my practice is a better version of my practice. And I think even the journey I got to this point where I'm like somebody who even talks on this stuff is that I take a lot of CE courses, and so I had a friend in North Carolina. Shout out to Danielle Gill, and she is her local district's president. And she's like, "Hey, I want to do a talk on AI. Who's a good speaker out there?" And so I was like, "Oh, I'm listening to this one course here, this one course over there." And I think the problem I had with some of those courses or webinars I listened to is that nobody was talking about like, "Hey, this is how you use it in practice." Like it wasn't very practical. It was like teaching me about what a large language model was or what machine learning is and isn't, and it wasn't much like, hey, this is what you can do to make life easier for you as a clinician. So I like offhand mentioned to her, like, man, I could have given a talk about that. And so I ended up giving the talk at her meeting, and it was just fun to kind of like delve into what you can do and you can't do, because there's a ton of things you still can't do, but there's also a ton of things I think will make your day-to-day life easier as well. So maybe I'll throw the question right back at you. Like what in your day-to-day practice do you like enjoy doing that like energizes you? And then where's the stuff that you like can't stand? Or where's the stuff that you wish that and maybe you already have somebody else taking care of it, but where's the stuff that you'd be like, man, I wish somebody else would do that for me?
Yeah, I mean, I think of course, love the surgery. The big part of I think most of us surgeons find painful is the documentation. Uh, you know, finishing up a day of surgery and then having to write notes or writing notes between patients. So certainly that's not my favorite. Have you had any success using AI to help with note taking or writing notes?
Yeah, so absolutely. That's probably my primary case use for it. I'm not here to like promote a certain product or anything like that, but I have been using Kubo Surgical for September of 2024. So I'm coming up on 2 years using it. And so started out as something that would ambiently listen to my notes, listen to my conversations. especially for consultations. I found that I would spend probably more time on my notes for consultations. Procedure notes for me were much more templated, much more, just click a couple things here or there. But for those consultations, especially if there's like a long HPI or somebody's got a little bit more extensive health history, that you want to just make sure you don't miss the fact that, oh, they took their Prolia shot 3 months ago and they've had radiation to this degree or whatever it was going to be. And so for consultation notes, ambiently listening was really nice. And then even in the last couple of years, how much it listens to, what it pulls into a note, how it, phrases it, has been pretty amazing. I did my own math for stuff. I think on average it would take me about, 3 to 4 minutes to write like a big implant consultation note or a third molar note. And the nice thing now is I think I can get it down to like under a minute per note. So it doesn't eliminate this burden of documentation, but it definitely slims it down quite a bit. How do you do notes right now?
Yeah, I mean, at the moment, it's using things like was mentioned on that prior podcast, like Text Blaze, where there are templates that um, have like little set pieces there that you can kind of click in and click out. But that's still how I'm doing it. With your Kubo surgical, how are you recording it? Like, do you have this on your phone and you hit record? Is there something set up in the operatory that's recording what's going on there in the conversation, or how does that work?
Yeah, so and then again, just to be balanced on this, like there's I think there's plaid or plod maybe is what it's called. And I know that a bridge is the big one that's used in like hospitals on the West Coast. And then there's also I know a lot of people who will just like ambiently record it on their phone and then throw it into one of the the generative AI tools like ChatGPT or Claude and then write their notes that way as well. But the way I do it is I started out with iPads. I have 3 ops in my practice. We had an iPad per room, and so then we would basically hit record on the app within the iPad. We started out that way, and then what we ended up doing was we ended up switching over to webcams because it seemed to catch the noise from everybody, or if my patient moved from a consultation chair to the operatory chair and they still started talking or telling me something, I'd still be able to catch it in that way as well. So the webcam's not recording anything, I'm just using the microphone on it. But yeah, it seems to pick up things really well. I'm also impressed that it can still pick things up even if like a fan is going off in the room or you hear like ambient chatter out in the hallway. It's not picking up any of that stuff and it seems to tune out a lot of that stuff. And so like I said, it's not perfect, but it's much better than I was expecting it to be.
Nice. So I will pick that up, and then do you have that webcam is linked to something where you can later on attach that to a patient, or how do you
No,
like get
no,
that?
not even transferred. Sorry. So the way Kubo Surgical works is that it has a web app as well. So my team, the way the workflow works in my office is that patient comes in. Let's say we're just doing a third molar consult. So the assistant goes to the front desk. They'll pick the patient up. They'll walk them back. As soon as the patient's sitting down in the chair, maybe filling out some paperwork, my assistant will open up that web page or that web app and then go to the patient's chart and literally just hit record. And the microphone that it's using to record is the webcam. So it's already within that patient chart within Kubo's app.
Okay.
Yeah, and then she can go and start asking her questions. One thing I also love about it, and probably the same with most of ambient recordings, is that it doesn't have to be in a particular order. We all know that patients will start in one spot and end up in another, or even I'll start in one spot and end up in another. And so they'll be like, oh, here's my health history, no allergies. Let me tell you about this toothache that I'm having. Oh, by the way, I forgot to tell you that I do get a Boniva shot, once every year, and it'll clean all that up for you on the back end.
That's cool. That's
Yeah.
really awesome. It kind of synthesizes all that and puts the notes in a SOAP format or HPI or however it is you want it to be
Yeah.
organized.
I feel like I've tried everything with note taking. I've done dictations, I've done templates. I mean, I've worked at a couple of practices and we've had different EMRs and everything's a little bit different for how you can make things work. And I remember one time when I'd get behind with notes, I'd be like, man, I should just hire somebody who just scribes for me. And so, I mean, there's a ton of solutions to this problem. That's, I think, and I don't think anybody loves note taking or documentation, but I think we've all figured out a solution because we all need to do this for our, medical compliance and our, medical legal aspects of things. So if you've got a solution that works, great. The one thing I'd love to plug too is that I found that with these kinds of notes, I don't care how good you are at taking notes, like it'll pick up more stuff than you can even remember at the end of the day. So unless you have somebody like actively writing your notes while the patient's talking, you're likely going to miss things. So it's not just that it does a good job writing my notes and it saves me time. It actually writes better notes for me too. Things that I'll like look at the end of the day and while I'm reading the note, I'll be, oh yeah, I totally forgot about that they said something about that. And some of it's just like fun stuff that, hey, this patient's going on vacation in 2 weeks and they want to get this done beforehand. But sometimes it's like critical information that you're like, oh, I'm super glad that I did catch that.
Nice. That was really cool.
Yeah.
Yeah, any other suggestions or comments for people trying to use AI and improve their notes that way?
Yeah, so I mean, the other I think successful solutions, I think I mentioned some of those other companies that, people are using. There's one in the GP space, I think that a lot of people are using. Maybe it's Overjet. Don't quote me on that one, but I've had people who said that that one's, or maybe it's Denti AI. Anyways, one of those ones has been working really well for a couple of my colleagues as well. I do know some people who are the DIY versions, and so they'll ambiently record it on their phone. But there is that. I think you were getting to that point. Was that there is that? Hey, now I have to download everything at the end of the day, or have my assistant download everything at the end of the day. Then I need to upload it into something else. And if you're using a third-party software, then you got to like copy and paste it and put it back into your notes. And so, at the end of the day, for me, in my practice, I've learned that automation is going to be better than anything that I can do or my assistant can do. And so
Hmm.
if it is automated, that's valuable to me. And so it is, I think it is nice to have a service. And then I do know that this is such an evolving thing for a lot of EMRs. If I'm not mistaken, CareStack has their own version of it. We were doing a demo with Oryx and they were like making their own version of it as well. And so I know DSN's making their own version too. So I mean, I think it's something that everybody knows notes are a pain point, and so everybody's coming up with their solutions. I think if we like look at it a year from now, we'll have a lot of really, really good solutions to that. But yeah, I mean, I think most of these companies will also give like a 1 month trial for it. And so it's not too difficult to just, try it out while still doing your old system, so you don't have to like completely transition over to something else.
Are there any medical legal things where you have to notify the patient or have them sign something saying they know they're being recorded? I mean, um, I think it's inherently understood that whatever they're saying with their health history and what's going on should be recorded in some way. But is there any increased degree of like patient sign off you have to get if you're using this technology?
I give a verbal sign off for it, and this is kind of what I was advised to do by both my practice, my malpractice insurance as well as kind of the company itself. Was that I let them know I'm doing it, and I don't make it like a big deal or anything. I say, hey. I'm tipping my patient back. I'm going to say, hey, by the way, I'm going to be talking to the computer, and then don't worry, I'm going to make sure I answer all your questions. So they kind of know that, like, hey, I'm going to be verbalizing my exam out loud. So when I start saying stuff like three finger breadth thyromental distance or normal mouth opening or, Mallampati class one, they don't have to like get confused why I'm doing that. Most of the time, it's interesting because a lot of times people will think I'm like trying to tell an assistant to scribe all that stuff too. But I've made it very crystal clear now that, hey, I'm talking to the computer. And it gives me a chance and gives them a chance to say, hey, I don't want that to happen. But I can tell you in, almost 2 years, nobody said no to it yet.
Awesome. Yeah, that's fantastic. What other uses do you have for AI in your practice?
So for me, and I'll have colleagues who tell me that I maybe overuse this, and I'm probably guilty of that too. But I started out using like ChatGPT just to play with it. I use Claude and Gemini for different things as well. So for me, a lot of the stuff that if I went back to that pain point problem, is that the stuff at the front desk. I think a lot of practice owners have this issue where, hey, we've got a bunch of stuff that I'm not good at, that I don't have the skills at. Yes, I've hired people to do it, but can we do it even better? And so a lot of those things at the front desk that you may not love or like can be, have that AI as a tool for that kind of stuff. So let's take like the simple stuff. So if we were going to do something like insurance verification, or even just like audit management of like, hey, have we got this insurance, back? Have we got this stuff? We can input all of that stuff into something like, ChatGPT or Claude, as long as we keep the patient names out of it and be like, hey, which one should be the low-hanging fruit to go after for like claims? So you can be like, oh, this was just like a little mistake here or there. And they have software that does this as well. The company that comes to mind that I demoed probably 3 years ago is DocVicate. And I know there's much more people in that space as well. So we haven't signed on the dotted line with any of that for anybody yet, but things like that. There are other tools that you could use. when it comes to patient intake. And so one other tool that I had demoed for somebody was, hey, why do we have all this paperwork with, 50, 100, 200 questions on it? What if we made that like verbal, like it was a medical assistant who was going to be taking this from a patient? And so it's almost like somebody's going to be talking to a phone. What medications do you have? What health issues do you have? Have you ever had surgery? And so it's more of a conversation. I think that's really helpful for somebody who is an older patient or maybe not as technologically savvy. And so that's something that's a little bit easier to use. Another product that I used or demoed recently, but don't currently use, and I've been asking a lot about this in the space for answering phones and voicemails after hours. So I guess real quick, I would love to do that, implement something so that we have somebody who can answer the phone, whether it's an AI agent, even after hours. I think, at least me personally, I would love to always get somebody on the phone if I could. I don't love the idea that, I have to leave a voicemail and wait for somebody. And so if there was something simple like, hey, I just need to let the doc know this, or hey, can you resend my antibiotics to another pharmacy? Those simple phone calls, it could be handled by an AI agent. The groups that I'm part of that I've like asked, hey, has anybody used anything that's really awesome? Nobody's come out and said, hey, there's a clear winner in this space. But I did demo Mango's VoIP product, and it does seem the couple of people that I've talked to who have used it have been pretty happy. And so Mango, I think, is like a phone service, voice over internet. And so they'll like answer phones and then it'll summarize your phone call and then put it into the patient chart automatically. And so, like, instead of coming in the morning and listening to 10 voicemails and then writing it down and then sharing it with the appropriate people, it's already technically gone into their charts. It's summarized it for you and you just have a sheet done. So, like, for my front desk, I think somebody does that every morning for 15 minutes. And now, it can be done automatically for you. And I do think, again, there's other people in that space. Haven't found a clear winner, but I think we're pretty close.
Yeah, it sounds like it would be an interesting and helpful tool, especially after hours, if it could prioritize things and get that information quickly to the right people.
Yeah.
That'd be pretty cool.
Yeah. The simpler thing would be also that if you could take that, and I mean, I don't know how many phone calls you get where somebody just needs to reschedule or cancel, and it would be awesome when it would connect to the schedule itself and just do that for you. Probably is a good time to say that AI has its limitations and isn't perfect. So I don't know if you've ever used some things and asked questions and all of a sudden found out that hey, this got the math wrong, or this is not accurate, or I've asked it to do some like clinical citations for me, and I'm like, I don't think that citation says that, and you'll actually read the paper, and you're like, that kind of just like hallucinated that. I think of it as just like if I'm using a Google search, I still have to do my own gut checks on everything and still, trust but verify, and so. I haven't drank the Kool-Aid yet, where AI is the be all end all, but at the same time, I think you if you want to be a responsible user of any technology, you need to make sure that you double check and triple check everything.
For sure. Any clinical uses that AI can help with yet, or are we not quite there? I mean, what have you tried?
So clinically, I don't think I'm not using it clinically too much. I've definitely heard some talks on it. I've definitely seen some of the demos where it'll take a radiograph or a full mouth series and it'll like identify, hey, you've got recession here, you've got bone loss here, you've got, incipient caries here. And again, I don't know the validation point of that. If I were using that, I would definitely use it as a, hey, this is what I see with my own eyeballs. Let me click the AI button and then just verify that I haven't missed anything. Or it could be as an adjunct for your hygiene team or something like that. And so I think that's going to be really valuable once it does get validated. And maybe it is, and I just don't know it. But I'm not doing it for any diagnostics or anything like that. I take that back. I have taken a snapshot of something that looks unusual, and just for funsies, I've thrown it into like Claude or ChatGPT and say, hey, what's your differential on that one? And I think it's good, but it's not great. But it is impressive how much it'll do. It'll do a much better job than like a first year resident would do. And so that's I think a fun thing to try if you haven't already. But I've definitely used it in some of the software that I'm using. So for example, we're a pretty big implant practice, or at least 80% of our practice is implant based or implant adjacent services. We do a lot of our implant single cases with surgical guides. I use Dentique, and I'm sure this is very similar with something like Blue Sky Bio or Implant Concierge, but we'll take our CBCT, we'll take our intraoral scan, we'll upload it into the software, and it'll take it most of the way to the guide design for you. And I don't know if you necessarily want to call that, all artificial intelligence, but at least they've got the software up and running. And at least they coin it as artificial intelligence. So it'll take my 2 scans, we'll tell it what tooth we want to do. If it's an immediate implant, it'll remove that tooth on the digital wax up. It'll put another tooth in there if it's already a missing spot. It'll trace my nerve for me. It will segment anything I need to segment if I need to do that. It will merge my cone beam and my intraoral scan with me. I haven't done this yet, but it'll also, if I'm like, hey, I'm going to place the implant, or it'll ideally place an implant based on that information, and then I can tweak it from there, and then it could potentially also build, my surgical stent from that as well. And then the next step is my assistant will then move it over to the computer or the 3D printer and then print that and things like that. So I think I think it's definitely cool because it wasn't there even a year ago for me in my software, but it's just fun to see how they're using these tools to make things a little bit easier. Yeah, that's kind of what I've been doing so far.
Yeah, that's huge. Anything to cut down time, right? And get things going smoother and faster and triple check things, make sure there's no errors. I mean, it's pretty cool stuff.
Yeah, just like.
Thank you so much for listening to this episode of Everyday Oral Surgery. For more information on these podcasts, please visit everydayoralsurgery.com. I love feedback and would be very grateful if you would reach out to me via my email, grantstucki@gmail.com, and let me know what you thought of this episode. Or you can text me at 720-441-6059. Additionally, if you have any topics you'd like to hear about, or if you would like to be a guest on the podcast, please email or text me. I found many of my interviewees through people who have been contacting me and have been listening, and I've gotten so many great ideas for more podcasts, and that's what helps keep the podcast rolling. So I really appreciate you making that extra effort and helping me out with feedback and knowing what to do next on the podcast. Thank you so much.